Hi, this is Katie Marino for my final checkout. Hi, my name is Katie. I'm going to be your nurse practitioner today. Could you please tell me your full name?
Samantha Cerny.
Samantha Cerny presents to the office today for a checkup. Before Samantha came into the room, we took her vital signs, which were all stable. We measured her height and weight. We did the Snellen test, which showed that her cranial nerve 2 is intact. She has bilateral 20/20 vision. Samantha was able to give us her medical and surgical history as well as her current medication and allergy list. As Samantha sits here, I'm observing her general appearance. She's well dressed, appears calm, maintains eye contact throughout the exam. I'm noticing that her skin, no lesions. Taking a look at her hands, no lesions, the skin is warm. Her capillary refill is less than 3 seconds, which is a normal finding. Also noticing on her scalp, her hair is evenly distributed. Palpating her scalp for any tenderness. No bumps or lesions or nodules are noted. Taking a look at Samantha's face, I notice that all her features are symmetrical. I'm going to test for cranial nerve 5. If you could please close your eyes and let me know when you feel this.
Yes. 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 Yes.
Cranial nerve 5 is intact. I'm also assessing for cranial nerve 5 and 7. So I'm going to have Samantha close her eyes, open your eyes, lift your eyebrows, smile, stick out your tongue, puff out your cheeks. Cranial nerve 5 and 7 is intact. I'm now going to palpate Samantha's facial bones for any tenderness. Let me know if you feel anything. Any tenderness at all?
No.
I'm going to palpate Samantha's frontal sinuses and maxillary sinuses. Any tenderness?
No.
Also feeling for the temporal arteries, +2, and no bruise or noted. I'm also going to palpate for Samantha's lymph nodes. So I'm feeling the preauricle, postauricle, submandibular, submental, tonsillar, pre-cervical, post-cervical, deep cervical chain, and subclavicular, which are not palpated, which is a normal finding. I'm now going to feel for her TMJ. The joint moves freely and no clicking is noted. I'm now going to assess Samantha's eyes. Her eyes are symmetrical. The eyebrows hair is evenly distributed. Taking a look at her conjunctiva, which is pink. Her sclera is white, no irritations noted, and no yellowness is noted. Palpating her lacrimal apparatus, any tenderness?
No.
And no excessive drainage is seen, so that is a normal finding. I'm going to assess Samantha's cranial nerves 3, 4, and 6. So if you could follow my finger. Cranial nerve 3, 4, and 6 is intact. And I'm also going to assess cranial nerve 2. So if you could please cover one eye. Testing peripheral vision, tell me when you see it.
Yes.
And other eye.
Yes.
Cranial nerve 2 is intact. Using my ophthalmoscope, I'm going to take a look into Samantha's eyes using opposite eye. I can see through the ophthalmoscope that the red reflex is present. Her optic disc is round, and vessels are noted with no swelling. Using my flashlight, I'm going to look at Samantha's pupils. The pupils are round and reactive to light. Also, I'm going to take a look at the corneal light reflex, which I see a white spot in both eyes, which means that it's present. Next, I'm going to assess Samantha's ears. I can see by observing that her ears are symmetrical. I'm going to palpate the auricles. Any tenderness at all?
No.
So no tenderness is a normal finding, and also I don't feel any nodules. I don't observe any drainage at all. I'm now going to use my otoscope. To take a look at her canals. Pulling the tragus up and back. And taking a look at her ear canal, there's no redness or drainage noted. The tympanic membrane is gray and pearly. The hand of malleus is in the appropriate place, and the cone of light was appreciated. I would do that in both ears. Testing cranial nerve 8, I'm going to do the whisper test, so please repeat what I would say.
33.
And I would do this on both sides, so cranial nerve 8 is intact. Next, I'm going to observe Samantha's nose. Oh, I'm sorry, I'm going to go back and use my tuning fork to do the Weber and Rhine test. So, using the tuning fork, I would place this in the center of Samantha's head, and the expected finding would be to hear equal and bilaterally. Next, to do the Rhine test, I would take the tuning fork, place it on Samantha's mastoid bone. Once she stops hearing that would be the bone conduction. I would put the tuning fork in front of her ear, which would be air conduction, and a normal finding would be at a 2 to 1. Next, I will move on to Samantha's nose. So I observe her nose. I don't notice any bumps at all. The septum is midline. No irritation, no drainage at all. Use my light here to look up into the navel cavity. The mucous membranes are pink and intact. And then I would next observe Samantha's mouth. No lesions are noted. Her lips are pink and moist. Use my flashlight here to take a look. If you could open up for me and stick your tongue out. Good. I notice that all her teeth are intact. Her tongue is pink and moist. I would have Samantha lift up her tongue, check for any masses or lesions. I see that her uvula is midline, and her tonsils are grade 1. Next, I'm going to have Samantha stick out her tongue for me and move side to side. Cranial nerve 12 is intact. To test cranial nerve 9 and 10, which would be the gag reflex, I could stick a cotton swab and to stimulate the uvula for the gag reflex. Next, going to examine Samantha's neck. So first, I'm going to palpate the trachea, which is midline. No masses are noted. Next, I'm going to have Samantha move her neck from side to side to test for range of motion. Good. And ear to shoulder, good. To test cranial nerve 11, I'm going to have Samantha lift up her shoulders. Good. Cranial nerve 11 is intact. I'm now going to check Samantha's thyroid. So how I would do that is go behind her, place my hands here, displace the trachea, and please swallow. Good. So the thyroid has no masses or nodules on it. Next, I'm going to test Samantha's upper extremities range of motion. So if you could please roll your shoulders back and front. Shoulders are intact. Stick your arms straight out for me. Cross. And then behind. Good. And then if you could stick straight out, we're going to test your wrists, flex, and extend, and fingers. Good. All is intact. Now looking at her arms, just going to palpate. Any tenderness at all?
No.
No. And if she didn't have, I could see any bruises, lesions, anything like that. Now going to check for pulses. So the brachial pulse and the radial pulse are +2. Now I'm going to check her reflexes here. So I'm checking the brachial reflex, which is positive, the brachioradialis, positive, and then also her tricep, positive. So I would do this on both arms. I also noticed there's no edema on her arms at all. And I'm going to test her coordination. So if you could please close your eyes for me and stick out your fingers and touch this finger to your nose. Great. And now this one. Good. So her coordination is intact. Now going to have you close your eyes and draw a number. If you could please tell me the number.
30.
Good. And I'm now going to place an object in your hand. If you could just tell me what it is.
Tissue.
Great. Okay. I'm now going to have you turn around for me, and I'm going to examine posteriorly. So I'm going to have you take a deep breath. Good. So just from observing, I can see that she has unlabored breathing. It's symmetrical. No distress is noted. I'm now going to palpate. So over the lung fields, I should hear resonance. And then to be able to find the diaphragmatic excursion, I'm going to have you take a deep breath and hold it. And I palpate for the resonance until I get to the dullness. Once I hear dullness, that's where the diaphragmatic excursion is. Okay. I'm now going to take a listen and auscultate her lungs. Take a deep breath for me. Another deep breath. Another. So lung sounds are clear. There's no adventitious lung sounds heard. I'm now going to test for tactile fremitus. And by doing this, I hold my hands here and have you say 99, please.
99.
And I would do this throughout all lung fields. While she's facing this way, I can also test for CVA tenderness. So let me know if you feel anything. Any tenderness?
No.
Okay, which is a normal finding. All right, you can turn back around. And if you want to just lay down for me, please. Okay, so now I'm going to check for Samantha's carotid arteries, which are +2. Take a listen. And no bruits are heard, which is a normal finding. While she's lying here, I'm always observing her skin color. I'm observing for any heaves at all. I can put my palm here to see if I can feel any bruits, any heaves, anything abnormal. I'm now going to take a listen to Samantha's heart. So I'm going to listen to the aortic, pulmonic, Erb's point, tricuspid, and the mitral. A normal finding would be to hear S1 and S2. I did not hear any extra heart sounds or any murmurs. In order to check for mitral stenosis, I could have Samantha lay on her left side at a 30-degree angle and use the bell of my stethoscope to hear for that. I'm now going to move on to the assessment of Samantha's abdomen. So I'm observing the stomach for any striae, any bruising, any ecchymosis around the umbilical, any abnormal findings. Her stomach would appear to be flat. And then I'm going to listen for bowel sounds. So I would hear in the So you can listen for bowel sounds for up to 2 minutes in each quadrant. Her bowel sounds are normal active. An abnormal finding would be hyperactive or hypoactive. I am now going to percuss Samantha's abdomen, which I hear dullness. In the left upper quadrant, you can hear tympany for a gastric bubble. I'm now going to palpate. You go from light palpation to deep palpation and assess for any tenderness. Any tenderness?
No.
Okay, I'm now going to use deep palpation. Any tenderness?
No.
I'm also going to listen to Samantha's arteries. I'm assessing for an abnormal finding such as a bruit. So I listen to the aortic artery, the bilateral renal arteries, bilateral iliac arteries, and bilateral femoral arteries. Also, while she's lying here, I could palpate the femoral artery, which is a +2 bilaterally, and also I could palpate for the inguinal nodes, which are not palpable, which is a normal finding. Okay, you could please sit up for me. I'm now going to assess Samantha's lower extremities. So I'm just going to check for any edema, any tenderness at all, which, any tenderness when I did that?
No.
Okay, great. Now I'm going to check for range of motion in the lower extremities. So if you could please have your, like straight, sorry. And then bend your knee, good, straight again. Flex and extend your ankle and your toes. Great, so I would do that on both legs. Now I'm going to assess for arteries. So the popliteal artery, the dorsalis pedal artery, and the posttibial artery. All are +2 and palpable. Now going to assess for deep tendon reflexes. So we have the patellar and the Achilles. And I also would assess the plantar reflex, which would be a curl of the toes. An abnormal finding would be the spread of the toes. I'm now going to test the coordination. So if you could please put your heel down your shin. Good, and other. Great. Okay, so her coordination is intact. I'm now gonna have Samantha stand up and bend over for me. I'm gonna observe her spine. Any tenderness at all?
No.
No, and no you can stand straight up. And no masses are noted, which is a normal find. I'm going to test the range of motion of her spine by having you lean back. Great, and side to side. Good, and twist. Good. The spine's range of motion is intact. Now going to assess Samantha's gait. If you could walk forward for me. Great, and walk back heel to toe. I'm looking for any swaying at all, which she does not have, any shuffling. Now if you could walk on your toes. Balance is good, and back on your heels. Great. I'm also going to test her balance by doing the Romberg test. So if you could close your eyes for me, and you notice no swaying here. Also going to do the pronator test. If you could just stick your arm straight up. Great, and close your eyes. I'm noticing that both extremities are staying at the same level. There's no weakness on one or the other extremity. And that concludes my assessment. Thank you very much.